Myringotomy tube descension tutorial. Recurrent otitis media, or recurrent ear infection, is a common problem in children. This is often due to eustachian tube dysfunction. The eustachian tubes connect the middle ear to the back of the throat. In children, the eustachian tube is small and enters the throat at a flat angle. The small size and flat angle of the eustachian tube cause blockage and buildup in the middle ear. Fluid buildup in the middle dampens hearing and increases the risk of ear infections. When infection is present in the middle ear, it can be painful and may even break through the eardrum. Chronic otitis media or eustachian tube dysfunction is commonly treated with myringotomy tubes or ear tubes. Myringotomy tube insertion is one of the most common surgical procedures performed. A small incision will be made in the eardrum away from the ear bones. This incision should be in a radial fashion similar to a spoke on a bicycle tire. Your surgeon will gently insert a myringotomy tube in the small hole in the eardrum. This ear tube will allow ventilation of the middle ear and reduce fluid buildup. After the procedure is completed, you will be awoken from anesthesia and sent to the recovery room. Be sure to keep water out of the ears and use earplugs when showering or swimming.
Glue ear is a build-up of fluid in the middle ear and is a common cause of impaired hearing in children. Let's have a look at how the ear works. The ear is divided into three parts: the outer, middle, and inner ear. The outer ear is made up of the auricle, which is the part of your ear you can see, and the external auditory canal, a short passageway inside your head that ends at the eardrum, a thin membrane that separates the outer and middle ear. The middle ear contains three tiny bones, or ossicles, known as the hammer, anvil, and stirrup. When sound waves hit the eardrum, it vibrates, which causes the linked bones to move and pass on sound waves to the inner ear. The hearing nerve picks up the sound waves and sends signals to the brain, allowing us to hear. So, what causes glue ear? The middle ear is normally filled with air and is connected to the back of your nose by a narrow canal called the eustachian tube. The tube is closed most of the time and only opens when you yawn or swallow, allowing air to move into the middle ear, and therefore keeps the air pressure on both sides of the eardrum the same. If the eustachian tube becomes blocked or swollen, it can stop air from getting into the middle ear, causing a vacuum that draws fluid into the area. This fluid becomes thick and glue-like over time and prevents the ossicles from moving freely, which reduces the flow of sound waves to the inner ear and affects hearing. In most cases, glue ear clears up without treatment, and doctors normally suggest a period of watchful waiting to see if it clears up on its own. However, if it does not go away, or if it keeps coming back, your doctor may suggest an operation to insert a small tube called a grommet. Grommets are not a cure for glue ear, but help to bring air back into the middle ear, which improves hearing. The surgeon will start by making a small hole in the eardrum and draining away the fluid. The grommet is then placed in the hole, which allows air to move in and out of the middle ear, and the ossicles to move freely, thereby restoring hearing. Grommets usually fall out after 9 to 15 months, and around 30% of children who have had grommets inserted will need them replaced.
A myringotomy, also known as a tympanostomy or tympanotomy, is a surgical procedure to remove fluid in the middle ear and re-establish equal air pressure on both sides of the eardrum. The ear consists of three main parts: the outer ear, the middle ear, and the inner ear. The outer ear includes the pinna, which collects sound waves, and the ear canal, which transports sound waves to the eardrum, a paper-thin layer of tissue separating the outer and middle ear. Sound waves cause the eardrum to vibrate, which in turn vibrates three tiny bones inside the middle ear, called the malleus, incus, and stapes, which pass the sound vibrations along to the inner ear. The inner ear translates vibrations into electrical signals, which are picked up by the auditory nerve, sent to the brain, and interpreted as sound. This complex process occurs instantly, allowing us to hear the sounds around us as they happen. For the eardrum to vibrate properly, the air pressure in the middle ear must be at the same level of pressure as air outside the ear. Air enters the middle ear through the eustachian or auditory tube. When you yawn and hear a pop, your eustachian tube has just carried an air bubble to your middle ear to equalize the pressure. An infection, allergy, mass, or enlarged adenoids can block the eustachian tube, allowing fluid to collect in the middle ear. Fluid prevents the eardrum from vibrating properly, blocking normal transmission of sound through the middle ear, which may cause hearing loss. In some instances, the fluid small incision in the eardrum using a scalpel or laser and drain the fluid in the middle ear. In many cases, the surgeon will place a ventilation tube or PE tube through the incision. This small tube will drain any fluid that collects after surgery and allow air into the middle ear to help dry it out. If necessary, the surgeon will repeat the procedure on the opposite ear. The entire procedure takes 30 to 60 minutes. The incision in the eardrum will heal itself